Good morning, everyone. Again, I'm Dr. Margaret Upchurch. I go by Meggie, and I'm one of the MS Fellows, which means, as you just heard, I'm done with my residency and have chosen to specialize in MS. So I'm really excited to be here today and talk about something really important, which is fatigue and MS. And so we'll go ahead and get started. All right, so these are the objectives of the talk. We're basically going to talk about what is fatigue and how impactful and prevalent is it in the MS community. We're going to talk a little bit about why MS fatigue happens, and then we're going to talk about what we can do to treat it. And specifically, this talk is really geared towards a non-pharmacological approach, meaning not with medications to treat fatigue, but what kind of lifestyle or behavioral techniques can we use? And we're going to focus specifically on energy conservation techniques. So what is fatigue? This is something that can be difficult to define. It can kind of bleed into a lot of different other symptoms, but I like this definition of fatigue as a significant lack of physical and/or mental energy that is perceived by the individual or caretaker to interfere with usual or desired activity. And the MS International Federation has recognized two different types of fatigue, the physical or motor fatigue, and then the cognitive or mental fatigue. And so this physical fatigue is more of like if you're needing to take breaks walking because you're getting, exerted, more of like the weakness or this like physical inability to perform your daily tasks. Versus the cognitive or mental fatigue, which is maybe more what we classically think of as fatigue, as this like decreased alertness, decreased energy, slowed responses, brain fog kind of symptom. And I think that, everyone in the room, even those without MS, can understand a little bit about fatigue or experience fatigue, but there's really a difference between MS fatigue and this kind of typical fatigue that human beings can experience. And there have been a couple papers or studies that looked into what qualities can differentiate MS fatigue from typical fatigue. And so these are a list of some of those features. MS fatigue is more likely to occur on a daily basis, not just in situational, like if you didn't get a good night of sleep or something like that, but really on a daily basis. It's more likely to worsen as the day progresses. So maybe in the morning you do okay, but then after you've kind of expended a lot of your energy in the morning, you're now starting to get that fatigue. MS fatigue is typically worsened by heat and humidity. And I think a lot of, we know that heat can really make MS symptoms worse overall. And so we find that with fatigue too. MS fatigue can come on easily and can be more severe and can really interfere with responsibilities and the physical functioning aspect. And so now that we've talked a little bit about what is fatigue, we can talk about how common it really is. So there have been various studies looking into the prevalence of fatigue in people with MS. And as you can see from this first bullet point, there was a big systematic review in 2021 where they looked at various different studies that tried to measure the prevalence of fatigue. And they came up with a range of 36 to 78%, which is a huge range. And usually when you see a big range like that in a study, it means that there were differences in how they're measuring fatigue and that fatigue can be something that's difficult to measure. Other estimates have shown it's up to 95%. So I think it's something that we know is extremely common. And with that, there have been other surveys showing that of all people with MS, when they looked at the study of all people with MS, they showed that half of them said MS fatigue was their most bothersome symptom. So not only is it really common, but it's a really impactful and bothersome symptom. And then interestingly, the presence or severity of fatigue is not reliably related to things like your age, your gender, level of disability, or how long you've had MS. And fatigue has a huge impact on daily functioning, employment, mental health, and quality of life, as you all know, and is one of these big invisible symptoms of MS. So it's definitely something that we should all be talking about and trying to address because we know it's really common and impactful. And so why is fatigue so common in people with MS? Well, I like to kind of split it into two different categories of causes. So we have the kind of primary causes on the left side here in this Venn diagram. And the primary causes are like something about MS itself that's causing fatigue. And then we have the secondary causes, which are other factors in our life that are impacting or causing fatigue, like sleep disorders or depression, hormones, medication side effects. And I want to point out that some of these secondary causes are actually more common in people who have MS. So we know that people with MS are more likely to have depression and sleep disorders. And so it may be that MS is kind of indirectly affecting these secondary causes and making some of them more likely to happen. And in the next couple slides, we'll go over these different causes in more detail. But something about this combination of MS itself and these other factors, you can see that that could really create a lot of fatigue for someone with MS. So talking a little bit about some of those primary mechanisms of MS fatigue, and again, this is something about MS, the disease itself, that's causing fatigue. We do not understand this very well, so everything on this slide is really theories, but nothing that's been proven exactly to be true because we still just don't know exactly why. But some of the theories that have a little bit of data behind them are that maybe there's this pro-inflammatory cytokine release. Cytokines are like these immune messengers in the body. So something about the inflammatory nature of MS itself is contributing to fatigue. And we've seen in studies that there's been at least a correlation with higher inflammatory cytokine levels and increasing reports of fatigue on fatigue scales. Other theories are that it's something about the demyelination and impaired axonal conduction efficiency itself. So basically, the messages are they're having a slower time getting from the brain or spinal cord to where they need to go. And so it's taking more effort, more energy to get those messages to go through. And this can partly explain why we see a lot of heat sensitivity in MS, and it's interfering with that nerve conduction there. Mitochondrial dysfunction is something that comes up a lot. You remember mitochondria is the powerhouse of the cell. So your kind of power stores, maybe there's something that's not working quite right with them in MS. Endocrine issues have been brought up, but that one has a little bit less information behind it. And then I think this last point is the one that makes the most sense to me and easiest to conceptualize, is that there's this excessive amount of work that has to happen to perform a task because of areas of damage from MS. So we can kind of understand this in, for example, if someone has a stroke, that part of the area is damaged and the brain has to compensate and recruit other areas to do the function of that part of the brain that was damaged. And in MS, we have damage not just in one location, but in different locations in the central nervous system. And so to do any task, it's having to recruit extra areas, and that requires more glucose, energy to get that function. And that's actually been shown on functional MRIs, which are different from the MRIs that we order in clinic. These are MRIs that show like what parts of the brain are being activated. And so you see more parts of the brain being lit up in people with MS performing a task compared to someone who doesn't have MS. So now talking about some of these secondary causes of fatigue. And I think these are especially important to talk about because we can target these a little bit more specifically. So poor sleep and sleep disorders, I think we can all understand that if you aren't sleeping well, you're not getting enough sleep, not getting a good night's sleep, that you're going to have more fatigue. Mood disorders like depression and then just increased stress in general can be a big contributor to fatigue. Side effects of medications or substances. So, some of the medications that we use to treat things like spasticity and pain, those medications are calming down the nervous system. And with that, we see side effects like sedation or increased sleepiness. Or substances like alcohol or tobacco can be contributors to fatigue. Physical deconditioning and inactivity can be a big one. And we'll talk a lot about exercise later. Poor diet, and by poor I really mean like eating a lot of processed foods or kind of not getting enough of that like whole balance of fruits, vegetables, healthy grains, and proteins. Hormones and menopause. Medical comorbidities like infections, thyroid disease, anemia, things like chronic kidney disease or heart failure can also be contributors. And then untreated pain can be a big one too. And so specifically, I wanted to dive in a little bit to the evidence behind sleep, diet, and exercise in MS fatigue, because these are things I think I always bring these up when I'm talking about fatigue with my patients, and these are things that we can really target. So for sleep, we do see a higher incidence of sleep disturbances in people with MS, and particularly obstructive sleep apnea. In one study, you can see up to like almost 60% of people with MS having sleep apnea, and that's something that can be treated with a CPAP machine. And one sign of a sleep disorder being a contributor is waking up not feeling rested. Again, typically your kind of classic MS fatigue is going to be worse as the day progresses, like you feel good in the morning, but later in the day it hits. So if you're already waking up feeling not rested and fatigued, that could indicate that something is going wrong in sleep itself. Diet, this is something that's notoriously difficult to study. If you can imagine, it's hard to get a lot of people to all eat the same thing. And so hard to study, but when they have looked at it, fatigue is the MS symptom that's the most often improved in these studies. And they have seen a higher adherence to the Mediterranean diet being shown to reduce fatigue in people with MS. And I'll get into a little bit more about the Mediterranean diet later. It's essentially just eating whole foods. And then there was a meta-analysis, so they looked at a lot of different studies, 12 different studies, comparing 8 different dietary interventions, and showed that there was fatigue reduction with the Mediterranean diet and then the paleo groups, which again, the common theme between those two diets is that they both really focus on limiting processed foods and eating more like whole foods. And then for exercise, there's a lot of data I could show on this, but I'll just sum it up with this Cochrane systematic review, which this is a very large review of different studies, and they showed that exercise in MS showed at least a moderate benefit in MS fatigue in contrast to a lot of the medications that we have. So again, I think between medications and exercise, we know there's a lot of bang for your buck with exercise. And interestingly, animal studies have shown exercise to have this remyelinating potential. So not only is exercise something that's important for fatigue, but in MS itself, we think that it might help reduce the risk of progression or slow down the rate of progression. And that's true for other neurodegenerative disorders too. And so now we've talked a little bit about what is fatigue and why does it happen. And so now we'll get into how can we manage fatigue. And I think right before we talk about that, it's important to kind of talk about how we assess fatigue. How do we keep track of this? And so there are many different methods out there. One that I found is this Rochester Fatigue Diary, and it's basically just a tool to keep track of how bad your fatigue is every hour for a day. But you can do that on your own or use whatever other type of journaling or diary that you prefer to just keep note of when am I having the most fatigue in my day? Is it impacted? How did I sleep this night? Like what time of year is it? All of those factors can be helpful in assessing your own patterns of when fatigue is the worst so that then we can implement strategies to address it. There are now more and more things like wearable technology like smartwatches and smart rings. And this is not measuring fatigue directly, but can be a helpful tool to keep track of your sleep and your activity level. But really, there's no one test for fatigue. I can't point out fatigue on an MRI. I can't order a blood test that's going to tell you how, if you have fatigue and how bad it is. But depending on the situation, it might be appropriate for your provider to get a sleep study. Again, if you're kind of not waking up rested and having other signs that you might have sleep apnea. Or it might be appropriate to get blood tests to look for some of those other medical causes of fatigue, like thyroid problems or anemia, which are things that can potentially be treated. All right, and so now getting into some of these methods of managing fatigue, and again, non-pharmacologic is just meaning not using medications. What kind of strategies can you implement? So diet, we've already talked about a little bit, but really the general recommendation is something like the Mediterranean diet. And this is kind of what I think most of us think of a healthy diet. So it's a combination of fruits, vegetables, whole grains, like lean meats or other proteins, limiting alcohol. And really, I think the main focus is trying to eliminate or reduce processed foods and simple sugars as much as possible, because we know those can lead to energy crashes. Other techniques that can be really helpful are things like mindfulness and cognitive behavioral therapy. Sleep hygiene, which these are things like optimizing your sleep environment as much as possible. So like limiting screens at night, keeping your room temperature good, like all of these kind of techniques that go into setting you up for success for a good night's sleep. And then cooling therapy and temperature regulation are huge and can help with kind of recharging that energy battery. And then I have a whole slide on exercise because I think that it's so important. And this is getting a little bit more into the specifics of what kind of exercise routine is recommended, because this is a question that comes up a lot in clinic. And so this first bullet point is kind of like the ideal exercise regimen, and that's essentially a combination of different types of exercise. So aerobic exercise, which is something that's getting your heart up a little bit. This is going to be like walking, running, cycling, swimming, those kinds of activities. So ideally doing that about 2 to 3 times per week. Resistance training, which is like weightlifting, doing that a few times a week. Stretching every day. And then neuromotor exercises at least a few times per week. And these are things like Pilates, Tai Chi, yoga, dance, kind of like exercising that real like brain-body connection, and these more complex movements can be really helpful. And again, I know that sounds like a lot, but something is better than nothing. And so if you can just put a little bit of these in your routine, even if it's just walking a couple times a week, that's better than not walking at all. And then kind of slowly increase your activity level over time. And then adaptations. There are all kinds of things to get exercise in different ways. So using assistive devices, arm cycling if you have a lot of leg weakness, even just the things like breathing exercises, posture exercises, and sit to stand. All of those things are good substitutions. Pool exercises can be great, especially if really heat sensitive, and if exercise, as you're exercising, you're building heat to your sweating, and that can cause a little bit more fatigue or cause your old symptoms to come out in some people. And so pool is a really good way to kind of deal with that. And I get this question a lot about, well, how do I know if I'm overdoing it or doing too much exercise? I do want to say that that's not going to be harmful for your MS, but it can leave you, feeling really tired or drained, especially in the rest of the day or the next day. And so it can be helpful to meet with a physical therapist to get a more targeted exercise routine if that is something that you're worried about. And I do just want to put in a plug for the Rocky Mountain MS Center online exercise classes and hydrotherapy as a good way to get involved with exercise on a more regular basis. All right, so now we're going to talk a little bit about some of these energy conservation techniques. And I want to introduce this concept of energy budgeting. So I want you to imagine that your energy level is kind of like a currency, and you get a certain budget per day. And so instead of thinking about how much time something is taking you, thinking about how much energy it's taking and how many coins is this activity going to take, and understanding that your budget at the beginning of the day might be a little bit less than someone who doesn't have MS, and really shifting the mindset of managing that budget wisely rather than trying to just push through every day. You wouldn't want to spend all of your money right at once and go into a lot of debt. And so it's the same thing with managing your energy. You want to use your energy wisely and take breaks when needed. And so we're going to talk a little bit more about that. And so again, I think the way that these energy conservation techniques are the most helpful is when they're really tailored specifically to you. And so doing that pattern tracking is going to be really helpful to to know your specific times of day that are really hard. And then schedule breaks when you've identified those patterns for yourself. And schedule those breaks before you know that you're going to hit that wall. And just know that taking breaks and resting is not failure. It's actually being strategic and using that energy budget wisely. And utilize assistive mobility devices and cooling therapies when able. And so, could combine like using your a cooling vest or a fan with taking a break at the same time to help recharge. And then this is a little bit more about protecting kind of your like mental bandwidth and things that you can do. So simplify decisions when able, like what do I wear today? What meals should I make? Did I take my medication? Like using a pill box or other methods to simplify those decisions so you're not using as much energy to make those kind of everyday decisions. And then social and sensory overload, I think, is a big thing that isn't talked about a ton. But really, like, what can I do in my environment to kind of protect my energy? What things are kind of like stealing my energy that I'm not aware of? So, like, I think our phones are can be a big source of that. So silencing, notifications for a period of time, or avoiding things like doom scrolling. Noise canceling headphones or reducing visual clutter in your environment can also be helpful. But just know that these are going to be really personalized to you. I just want to point out, like, noise canceling headphones can be helpful to some people, but can actually make some people feel worse. So if that's, I'm not saying that everyone needs to do that, but just find what is kind of triggering you or causing more of that fatigue. And learn to spot these energy draining encounters and set boundaries. I think this is a big one that's definitely easier said than done. But really learning to protect yourself from draining encounters can be extremely helpful. And that's what this next slide is a little bit about. And you all should have received a handout on more of these kind of phrases that you can implement in your day to explain to people your energy limits in like a kind, respectful way. And so saying something like, I'd really like to join, but I have to manage my energy carefully, and today it's not possible. Thanks for understanding. And there's various different ones, and it's broken down into like for your family or at work. And again, just a way of respectfully explaining your energy limits. And these are good ways of being kind of kind to yourself, and also letting people know where you're at. And so with that, some of the takeaways I hope that you've gotten from this talk is that fatigue is one of the most common symptoms of MS and is different from regular fatigue. And ideally trying to optimize those secondary causes of fatigue as much as possible. So things like sleep, diet, exercise, mood are extremely important. And then learning some of these energy conservation techniques. So budgeting your energy, designing a system that works for you, and knowing that rest isn't failure, it's strategic. And so with that, these are my references. I will just say some of these references, if you're interested, have a lot of good information about like going more into things like diet and exercise if you're interested. But with that, thank you so much. And we'll take questions at the Q&A later.